In 2002, an independent panel of public health experts certified the WHO European region polio-free. 2022 marks the 20th year that the European region has sustained this status. To understand the weight of this achievement, we don't have to look back very far. In the 20th century, large outbreaks spread in ever-increasing waves across the world, paralyzing over 500,000 people every year. One of the last large outbreaks in the European region occurred in Denmark in 1952. At the height of the epidemic, 50 new polio patients were brought into the hospital in Copenhagen every day. Since the introduction of polio vaccines in the 1950s, incidence of polio has declined by over 99%. Because of this great progress, polio can easily be thought of as a disease of the past. Unfortunately, it is still endemic in 2 countries in the world, and as long as it exists anywhere, it is still a threat everywhere.
We need to make sure that there isn't this complacency and repeat this message that vaccines are the best thing in public health that we have.
The WHO European region is home to nearly 900 million people and stretches from Greenland in the west to the Pacific Ocean in the east. Ending the spread of wild polio in this vast and diverse region was a major step towards global polio eradication. Keeping the region polio-free requires as much commitment today as achieving it did in the 20th century.
There's no doubt that we have to maintain very, very high vaccination coverage. These viruses also know how to get to little pockets of unimmunized population. And one of the solutions for that is really to think out of the box, actually going out to them with mobile clinics, keeping clinics open outside of the normal hours, trying to find out what are the problems that they are having in having their children vaccinated. So we need to be in close touch with the community leaders and the religious leaders.
Until global eradication has been achieved, poliovirus can reappear in the WHO European region. Thankfully, health workers, epidemiologists, and lab experts in every country are keeping careful watch.
Bu durumlarda bize gelen şüpheli örneklerden hızlıca Dünya Sağlık Örgütü'nün izolasyon, identifikasyon süreçlerini takip ediyoruz. İdentifikasyon aşamasında eğer herhangi bir şüpheli durum olursa mutlaka öncelikle epidemioloji birimine haber veriyoruz ve bu kişinin ya da bu hastanın aşılama durumunu ya da klinik durumunu öncelikle sorguluyoruz. Bütün çalışan arkadaşlarımız gerçekten bir adanmışlıkla ve sadece orada yaşayan, o coğrafyada yaşayan.
Even one case of polio triggers an immediate outbreak response. Over the past 2 decades, several outbreaks have occurred in the European region. If transmission stops within 12 months, the region retains its polio-free status.
The first thing the countries have to do is to conduct investigation, and this is extremely important in order to understand how the virus may have appeared in this place and how it can be transmitted.
An outbreak of vaccine-derived poliovirus in Tajikistan, confirmed in January 2021, illustrates the importance of a quick response.
По рекомендации Всемирной организации здравоохранения был усилен эпидемиологический надзор за острыми вялыми параличами по всей стране, и в рекордные сроки были установлены эпиднадзор за окружающей средой в городах Душанбе и Бухтарской зоны. Таджикистан регион бюро ВОЗ принял решение использовать новую оральную полиомиелитную вакцину.
Polio vaccination campaigns in Tajikistan achieved very high coverage and brought a swift and effective end to the outbreak. In the past year, poliovirus has also been detected in Israel, Ukraine, and the United Kingdom. In all 3 countries, extensive measures are being taken to stop its circulation. The presence of poliovirus in the region is a wake-up call. It reminds us, as underlined in the European region's immunization agenda, that vaccination services must be expanded equitably to protect everyone from the tragic impacts of vaccine-preventable diseases.
We recognize and thank millions of parents, healthcare workers, public health experts, volunteers and governments who have invested their trust and time to prevent the spread of this disease.
Together, let's create a polio-free future.